Hi class, welcome to Healthcare Information System subject. Today we will discuss about the Healthcare Information System under special topic BITP 3423, and this is chapter 1, Introduction to Health Informatics. Okay, before we go in detail uh, about Healthcare Information System, so I would like to introduce to you all about the hand informatics. So what is the hand informatics? So this chapter is actually uh, to enable you to compare and contrast the various definitions of the healthcare information, to be able to describe the major type of healthcare information that are captured or used or most in healthcare organization, and to enable you to cite specific example of major type of healthcare information, to be able to compare and contrast the various definition of healthcare informatics. Okay, as you know that the healthcare is not a new thing in ICT, but before uh, I think before 4 decades, yeah, the healthcare is very weird in ICT. Yeah, all the process of healthcare services is done manually, and other industry like banking, accounting, manufacturing, they are ahead from the healthcare in terms of adoption of the ICT in their business process. So information in healthcare, before we go to the healthcare information system, uh, I want you to understand what is the information in healthcare. So, health science involve procedure of high complexity with reference to biological organization and their functions. So, if you look at the hospital, in the small context, there are a lot of discipline, or they call it department. In normal organization, we call it department, but in the context of healthcare organization, normally they call it discipline, or a small unit they call it subdiscipline. Okay, a disease is very often a result of interaction of a patient in their environmental and psychological psychosocial context. Yeah. So therefore, when evaluating health, many considerations should be made, and a large number of attributes need to be collected, stored, and retrieved during decision making. So the information is produced and communicated during the audit procedure. There are multiple users that share this information in the hospital and outside of the hospital. Very often, that same data accessed concurrently by different healthcare provider who will need this data for different purposes. So, in other words, that um, so healthcare is a reach of information, reach of data, because they play with the data, and when the data is chunked and processed, uh, so they become very invaluable information. So when you come to the hospital, when you visit the hospital, at the first encounter, encounter mean first visit, when you go to the counter to register. So the registrar will ask you about your biodata, right? So from that, they collect the data about you and family, and also your financial status. Okay, and then after your biodata is collected and stored into the system. Yeah, and then if you are new patient, so they will register you or key in all your detailed data, especially your name, your ID number, yeah, your uh, gender, your employment, your next of kin, yeah, and also the insurance. So this called the attribute that collected during the registration, and they store into the uh, database and become patient biodata or patient information. And then information change dynamically during the care provision. Example, after you got registered, then they send you to the specific doctor, and then doctor will consult you. Then during the consultation, so sometimes doctor will ask you about your past medication and past medical record, your family medical record. They will ask you, does your mother or father got any serious problems, for example, high blood pressure, diabetic, or stroke, or heart problem, and so on. So that information will be and stored into your patient medical record. They call it medical history. Yeah, and then when they diagnose you, when the doctor wanted to diagnose you, they will ask you to go for tests, lab tests. For example, to take lipid test, cholesterol, or urine test. And then you go to the lab, and the laboratory personnel we take a specimen from you and test, and the data is entered into the system. Yeah, and the doctor will wait for the result, and after the test is completed, so the test result will be sent to the doctor for the doctor to view what is uh, your health status, based on the lipid test, for example, based on your urine test. Doctor want to know that whether your glucose is normal or abnormal, or your cholesterol is high or low. And then they will give you a treatment, or they will advise you how to maintain your health status. Okay. Sometimes the doctor asks also for doing the procedure. Example, to do the X-ray, uh, uh, do ECG. Let's say you complain that your chest got pain, so they will check your heart beat, yeah, through ECG. Yeah. And then sometimes need for imaging observation, imaging examination. So they will ask you to go for X-ray. And then after they got the result, so doctor will plan your uh, your medication. They will prescribe the drug, and then you go to the pharmacy and collect the drug. So during your visit to the hospital, they call it episode. During the uh, specific episode, so every encounter you go or you visit, uh, there are a lot of data captured uh, for diagnose your health status. Okay, so from that information, from that data, so it become electronic medical information or healthcare information that collect and store for become as your electronic medical record. Okay, so the majority of health related information coming from the analysis of tag, numerical, image, video, and sound data. So information in healthcare is come from various source and various format of data. It's not only a text. It also involve numeric data, image data, video, sound data. Sound data, for example, to check your ear, yeah, uh, they call it audiometry data, yeah, and this all data will save into your uh, medical record, and when you come in the next visit, so it become a very important or crucial information for the doctor to give right treatment for for the patient. Okay, so the majority of health related information coming from the analysis of tech, like I said previously, and it is understandable that the healthcare information derived from the combination of many atomic health data which have to be accessed together to produce useful information for the clinical decision making and healthcare services. Okay, so uh, what I am saying just now, uh, this is all about the clinical data when doctor consult you, so, and then ask you to do a test, examination, and so on. That called clinical data. Yeah, and then your patient biodata is we consider is administrative data. So after you complete your process in getting a treatment in the hospital, after you get your medication, so you will go to the billing, right? So you need to pay the fees of the care. So this is not the clinical data. This is administrative data, financial information. So information in healthcare is a combination between uh, clinical data and also the administrative data. So at the first place that when you visit or you go to the counter department for registration, so this is a first called the registration process, uh, which involve the administrative function. And the last, when you pay the fees, is also the administrative data, which is a finance or financial information. Okay, I hope you understand what is the information in the healthcare. In short, information in healthcare come from two sources, administrative and also the clinical. Just now we discussed about the information in healthcare, and healthcare information come from two main source, like I said, from administration and also the clinical department. So we already discussed quite lengthy about the information in healthcare. Okay, this is a sample. Yeah, this is a flow of health information where it generated. So this is a three. They call it three entity. So this is a sample. The left one is a sample medical record information. So this is where the patient and hospital interact. Yeah. Uh, I take example of inpatient encounter and who responsible or party responsible when the patient uh, go to the hospital or clinic, right from the scheduling, yeah, pre-admission, admission, or registration, and then patient got the treatment, and then this is a medical process. Yeah, when the patient or you assign to the doctor, so this is a cycle. So it will repeat. Yeah, if you are inpatient, so you will assign to specific bed or ward, and then nurse will attend you. So if you admit for 3 days or longer than that, so every day nurse will do a nursing charting, and they will take your blood sample, take your blood pressure reading, yeah, take your urine and so on. So this is a process where the information is gathered and collected while you in the hospital for acute treatment, or you are outpatient patient. Yeah, so this is a process. So after the doctor uh, satisfied with your condition, yeah, so this is a case of inpatient. So they will discharge you, yeah, and then you will go to the billing department and pay the fees and go back. So every single encounter you will see, so this is information is gathered from this process. Okay, so first you will see this one. So when you come to the clinic, do a pre-admission, so identification sheet will be give to you to fill in the form and etc. So identification sheet, consent, authorization. So this is all information uh, gathered, start collected from the patient. And then when you go to the treatment room, or you go to the you are admitted to the ward, so the treatment is started, and this is a clinical information collected from your case. For example, if you got a problem, previous problem, so doctor will enter your problem history. Yeah, physical order, physician orders, doctor will order drug, order test, order images, and so on. So they will do a progress note. Progress note mean every day a nurse or and the doctor will take note or will write down your health condition, yeah, your health progress, whether getting better or worse. Yeah. Okay, and during the nursing, so nursing notes, nurse will take the regular test for you and give you medication every morning, for example, and the information is stored. Yeah, and then this is ancillary service is mean the clinical support, support service to the clinical, example radiology, lab, pharmacy, and so forth. Okay, so these are information also gathered from you, yeah, and then finally you will discharge. So every single of your encounter, from registration until you discharge, so uh, there are information or data will be uh, captured, yeah, for your episode. So this is your episode, and this is a lot of encounter. Okay, so when you look at the right side, the department or discipline involved in managing you or patient is actually the admin staff, that manage the scheduling, registration. Yeah, so these are hospital admission. So these are all the registration department or admission counter. Yeah. So and then when you were admitted in the hospital, and then one or two or common doctor will assign to you. Okay, they call it attending physician. Doctor will attend you to take uh, your complaint, your current diagnosis. So they will investigate by order to auxiliary services. So, and then this cycle is actually within you and doctor and nurse. So this is a process where the clinical information or clinical data is captured and collected uh, for a single patient. Yeah. So and then when the order is sent to the radiology or lab or pharmacy, so the party involved is a lab technician, radiologist, yeah, a pharmacist, and so forth. If the order is go to the dietary department, so dietitian, yeah, chef, involved in this process. So you can see that there are a lot of party, a lot of people involved in one healthcare organization. Yeah? So if you have a time, you go to the Kuala Lumpur hospital, so you will see that there are many health worker involved in each of the department. Yeah, there are a lot of doctor, nurses, ambulatory, laboratory, pathologists, radiologists, pharmacists, yeah, uh, to uh, provide the service to the patient. So and then when you discharge, so you will go to the billing department. Okay, the uh, account executive will attend you, so they will give you invoice, and then uh, the medical fees will be collected and stored into your database. So in general, yeah, so like I said previously, uh, in healthcare process or healthcare information uh, generation is involved two main process or main system, yeah, administrative and clinical. So by looking this flow, yeah, so you will get the full understanding, yeah. So where the administrative data is collected, and where and when the clinical data will be generated, yeah, from the process. So this is a process that you need to understand for you to develop the HIS, yeah, healthcare information system or clinical information system. So by looking at this process, so you will get the real picture. That's why I told you last time. So when you want to develop a system, any application, you need to understand the business process. So this is part of the business process, a simple process where you can get a view how the healthcare information is generated, and how you can offer the solution uh, of this process into the workable application, yeah, or system, computer system. Okay, uh, we already discussed on the healthcare information, where the information in healthcare is generated, and now we can define what is the healthcare information. By looking at the previous slide, two previous slide, yeah, I give you the lecture on the information in healthcare. What is the information in the healthcare? Yeah, it come from two main sources, admin and clinical. And then we can define the healthcare information. So this definition is come from the HIPAA, the Health Insurance Portability and Accountability Act. This organization is not in Malaysia, but is in US. Uh, what he said that, so healthcare information is any information, whether oral or recorded, in any form or medium, that created or received by a healthcare provider. Healthcare provider mean healthcare organization, hospital, clinic, uh, and health plan, public health authority, employer, life insurer, school, university, or healthcare clearinghouse. Okay, so any information, is recorded, whether oral or in written, so that is the healthcare information. Okay, another definition is, and then the health information relate to the past, present, or future physical or mental health or condition of an individual, and the provision of healthcare to an individual, or the past, present, or future payment for the provision of healthcare to an individual. So that means healthcare information is anything relate to the patient data, yeah, with regard to the administrative and also the clinical. We define that uh, that is the information in healthcare, yeah, or healthcare information. So clear, yeah, class. What is healthcare information? Is any type of information, whether oral or in written, in any form or medium, example text or images or uh, graph or wave, is considered as healthcare information. So why health informatics? Yes. So why we study this field or subject matter, healthcare and informatics? So health informatics provide information to make healthcare decision. Yeah. Without information, so the healthcare provider or healthcare professional uh, difficult or late to make any decision regarding their patient. Yeah. Let's say to browse or to view the patient past medical record is very difficult using manual system. Yeah. The clerk or nurse have to search from the drawer or from the file. Yeah, look at your past medical history one by one. Sometimes the written is not understand by the current doctor. Yeah, or maybe the ink is already blurred, so the current doctor cannot read the clinical note written by the previous doctor. So this is a problem. Yeah, sometimes the record is lost. Yeah, when take one example, that when the hospital is upgraded, or maybe some of the patient record is gone. Yeah, and we don't know. So by combine the health and computer science or ICT, so all the information is stored in the database. So you just type the name Kanapi, for example, and then you will get all the information in one press button. So health informatics provide better information, lead to better decision in providing the best treatment. Yeah, let's say you got the primary care uh, from uh, from Malacca Hospital, for example. Yeah, and then Malacca Hospital cannot continue the service uh, for your problems, so they will refer to the specialist center. Yeah. Maybe they will send you to the Putrajaya Hospital or to the uh, Kuala Lumpur Hospital, because Kuala Lumpur Hospital is a center of specialists, a center of research on the healthcare. So when they transfer you to the hospital Kuala Lumpur, yeah, if the hospital Kuala Lumpur and hospital Melaka, or we have a centralized system, so when you reach at the hospital Kuala Lumpur, very a very few seconds that doctor will can view your previous medical record, so they know that what is your problem. They can browse your CT scan, for example. They can browse your lab test, or your full blood test, and so on. So this will save a lot of money for the government. Yeah. So if, let's say, if the two hospital doesn't have a system, centralized system, when you uh, when you reach to the hospital Kuala Lumpur, so no system. They don't have a system to uh, get your previous information in single press button. Yeah, so they have to uh, admit you, okay, uh, put you in the ward for 3 days. Why they put you in the ward for 3 days? Because they want to investigate your problem. So maybe the same test, laboratory test, will be repeated. Will repeat, and uh, again test again and again. Take your blood from your hand, yeah, and then send you to the X-ray department, radiology department, to do a CT scan again. So this is very costly actually. Yeah. Even you have done this process in Hospital Melaka, but because of a trust of the information, maybe the transfer of data from Malacca to Kuala Lumpur uh, take time. So the doctor will decide that you need to do a retest, retest. Okay. So health informatics help healthcare management, planning, and policy all need complete information. So without the complete information, for example, if the hospital, a big hospital like Kuala Lumpur, doesn't have any hand informatics system, so the management part is very difficult to manage. Yeah, the administrator, the top management, are very difficult to do the to managing the hospital and do a planning, a good planning. And healthcare, health informatics, healthcare, health management, health policy, and health planning all depend on having complete information to make decision. Okay, nowadays is we are uh, all the developed country, yeah, they are not uh, they are now uh, uh, a step ahead from us. Yeah, so they are not looking on the fundamental system now. They are looking for the innovation. Yeah, that's why you will heard about the IoT. Yeah, you will heard about the data science, yeah, big data, and so forth. Yeah, so this is a innovation, but we still struggle in completing our fundamental system in the hospital. Right? We still don't have a CIS or HRS in all hospital uh, government. Yeah, in all government hospital across the Malaysia. Okay, so we still struggle how to integrate the EMR within the hospital. We still struggle how to implement the new system, and sometimes the system keep change. Yeah? Upgrade there, upgrade here, so no end. So a lot of money is gone. Yeah, and at last our cycle is within that our leg, our foot. Okay, so you can see that the other country, developed country, they are not looking at the fundamental part yet, because this is done already. Yeah. uh, in order to go for the innovation, of course, the fundamental, or the basic system must be in place. So this is what I'm trying to convince some of the hospital, or also the government agency, to look at the overall problem of the HRS implementation in Malaysia. So we should find one trust vendor uh, which can provide a total solution. It's not for money, is for helping the country, actually. Yeah, helping the country and helping the citizen, to get the healthcare services better than current or previous. Okay. Next is we discuss the category of information in healthcare. So I table here a lot of category of health of information in healthcare. So why we divide into four categories? Because it's easy for you to understand and easy for you to categorize the data and focus and prioritize which data is important when you want to develop the application in healthcare. So first is a patient-specific data. Patient encounter include clinical and administrative information. So that means this is a what they call it, raw data. Yeah, come from the patient. Example, like I show you. Okay, this is a patient specific data. When you go to the clinic or hospital or healthcare organization, so the data or information is generated from specific patient. Okay, another data is aggregate data. So this data is combined clinical and administrative data. For example, when you register the patient, when the registrar executive register the patient, so they will store your patient biodata, right? Your name, your ID, yeah, my card, your passport number, and etc. And then when you go to the treatment, when you reach to the treatment process, so the clinical data is start to be generated. And finally, you discharge and then involve the financial commitment. Yeah, so you need to pay the fees. So see, the aggregate data is actually the combination, yeah, for the patient, or for the statistic. Yeah, let's say the administrator will ask the top management will ask the administrator how many patient for the day. Yeah, how many cost, profit and loss for the day. For the private hospital, of course, they will see the profit and loss. So how much the cost, how much the profit. Okay, so that data is combined. Okay, 100%, and then the cost, let's say 1,000, for example. And then from the 1,000, how much the margin, yeah, profit margin. Okay, that is aggregate data. Another data is a comparative data. So this comparative data is used for both clinical and administrative purpose by healthcare provider. So this data also used from the internal and external data to be collected for benchmarking. For example, measure patient satisfaction and so on. Okay. Uh, some of the clinic or hospital, I don't know, in government hospital, they implement the questionnaire or not after the patient is discharged. So this is very good initiative, to know the healthcare services for specific healthcare organization is good or not. It depends on the customer, right? So the customer can give a comment or answer the question whether they satisfied with the uh, services for the hospital. So the comparative data is actually uh, example hospital A, they got the data for the patient satisfaction. So they will take this data and compare with other hospital. Example, yeah, this is very important, I think, for a Ministry of Health to do the benchmarking for each of their healthcare premise. Yeah, I think we got about 1,544 hospital across the Malaysia, and we have a lot of health center, yeah, klinik ibu dan anak, yeah, dental or dentist, dental clinic. We have health center like a polyclinic Aikalo, yeah, polyclinic Durian Tunggal, yeah. There are a lot across the Malaysia. So we can ask the patient when they discharge, when they want to pay the fees, after they take the uh, prescription. So we should give them a questionnaire whether they're satisfied or not. So from that data, we can plot the graph. Okay, maybe every month we can see which health center uh, was provide the good services to the patient. So this is very good comparative data to motivate the uh, to motivate each of the health center to improve their services. So another healthcare information, and another category is knowledge-based information. So this data is is a collection of fact, model, and information that can be used for designing and redesigning process and for problem solving. Knowledge-based information means this is come from the research, yeah, from other doctors uh, finding or research or resolution for the same problem. For example, let's say National Heart Center (IJN) uh, got a lot of patient of heart problem. Yeah, so we have another center or department of cardiology in Hospital Serdang in Serdang, Selangor. So if we compare between Hospital Serdang and IJN, International Heart Center, so there are a lot of patients in IJN compared to the Hospital Serdang. So from the experience of the doctor in IJN can be shared by the Hospital Serdang. So that called knowledge base. So a lot of experience, or what they call it, uh, I don't know the term. I forget the term. Yeah. So they can use this information for treatment or advice for the new doctor, for example, to uh, provide a good solution for certain problem in healthcare. Okay, this is an example of specific medical record. Okay, so when you go to the hospital, so this is an example of his, yeah, hospital information system, healthcare information system. So this is a patient info, your name, IC, your gender, age, your race, yeah, your blood type. Okay, So this is normally doctor will browse your what they call it patient medical record, yeah? And then they will see your previous diagnosis. Last time in pusat kesihatan you got cough, yeah? In 19th of February you got other serum reaction, okay? So in 25th of February you got flu, okay? So this is very comprehensive information. So doctor can browse and can see the chronology of your health, yeah? uh, and that's why I told you just now when we got the HRS, it helped the doctor to understand your problem, and he or she can provide a good plan for the treatment, and the most important is accurate treatment, okay? So this is example of his dashboard, screen for the doctor. So maybe I can show you the real system that we developed. So this is a queue. When you register to the counter, the patient will send to the queue, yeah? This is a electronic queue. So when doctor click this queue button, so a list of patient is already waiting for the consultation. Okay, next is a definition of informatic and ICT. So you must know and you must able to differentiate between informatic and ICT. So informatic is a science of information. Yeah? All the system that you develop, you as a software engineer, when you involve in oil and gas, for example, you involve in system application system for banking, yeah, for agriculture, for uh, what do you call it, retail, yeah, Mydin, for example. So it involves information. So from the information, you need a science there, yeah, a technology, computer science. People will use this information, and then to design the uh, information system. Okay, so the information is come from the business business subject matter. Yeah, for example, retail, oil and gas, aircraft, agriculture. Agriculture, when you want to develop an agriculture information system, so you need to know the agriculture process. Yeah, you should know the category of agriculture. Is it hydroponic, hypotonic? We have hypotonic? I don't think. So you should study the legacy plantation, using soil and so on. Okay, sign of information. Informatic is a sign of information. Define what is considered as information and how information is acquired systematically, by utilizing raw data. Like I show you the patient encounter. You got data and then you uh, save the data in the database. You got the database structure. So this is a science. You store the data in a systematic manner. We got format, yeah, we got data type, uh, we got to define the length of the data and so on. So this is a systematic uh, process how you manage the information. So informatic is a information processing, how the information can be used, what method can be applied, and transform into useful and usable knowledge. Okay, so from the inpatient encounter, okay, you got the patient biodata, you got patient clinical data. Okay, you take all the data, you design the data structure. Okay, you store the images data, you store the wave data, you design the text data. Okay, that is the uh, fundamental how you want to keep the data, and then you design how the data can be retrieved, can be displayed, can be uh, searched. Okay, so this is information processing. And then the informatic is the engineering of information system. It involves the engineering of system which involve uh, input of data and transformation to information with the use of appropriate method. The term also refers to the complementary network and hardware and software that people and organizations use to collect, filter, process, create, and also distribute the data. So engineering of information system mean you have analysis, you design, and you implement. Uh, with the combination of the subject matter and also the technical people. So you use a tool, software, hardware, network tool to develop a workable system. Yeah. So again, ICT. What is the definition of ICT? Can you define, student? You are in the computer science. Sometimes we underestimate. Yeah, we already said that I am a computer science student, so I know what is ICT. So when we ask the student what is ICT, maybe they cannot define verbally. Yeah. So this is a refresh for you. What is ICT? Is the communication technology and services that are used in various applications. So information, communication, and technology. ICT. The term describes this computer communication and multimedia technology that can be used to receive, process, store, display, and disseminate information. Okay, very easy. When we talk about ICT, it should have hardware, software, communication. Communication is network. Okay, now you understand the what is the healthcare information in healthcare, what is informatic, what is ICT. Then we go to the definition of health informatics. So World Health Organization definition an umbrella term referring to the application of the methodology and technique of information science, computing, networking, and it is a data-driven health informatics communication to support health and health-related disciplines such as medicine, nursing, pharmacy, and dentistry. Okay, we take from the WHO is an umbrella term referring to the application uh, that involve methodologies and technique, how you use the information science, computer, computing means hardware, software, networking, uh, to generate the uh, invaluable information for healthcare organization and help the healthcare professional to provide a good healthcare services to the patient. Oh, very long, eh? So when we ask you about health informatics, so don't memorize this definition. So we are looking for your word. Yeah? So this is another definition by Edward Short Life. You can read by yourself. Okay. So this is a diagram. You can see that health informatics is a combination or collaboration between healthcare and computer science. Yeah? So again, the health informatics definition. Health informatics is a interdisciplinary field. Uh, when you look at the hospital itself, there are many disciplines in one hospital. Uh, We got clinical department, we got oncology, pathology, radiology, we got pharmacy, we got specific or specialist department, they call it cardiology, pediatric, orthopedic, ophthalmology, ENT, what else? Neurology, yeah, uh, dentistry, and etc. So health informatics use information to improve healthcare. Health informatics studies the process where health data, information, and knowledge are collected, stored, processed, communicated, and used to support healthcare delivery to the client, providers, administrator, and health organization. So areas of interest for health informatics. So there are a lot of application. Yeah. So this called application or information system. Information is not called application when you not transform them into a systematic process. When you got the information, then you design the data structure, design the application, the communication, and then it become a proper system. So there are a lot of areas of interest in health informatics, communication system and network in healthcare modeling. So I bold here, healthcare information system. This is our focus or our subject focus. Of course, healthcare information system will involve electronic health record as well. We don't touch on the decision support system, uh, but the administrative decision making maybe we include, but it's very simple administrative application decision making system. Maybe we can produce a report. We can show the what they call it descriptive descriptive data science. Yeah. Okay. Report, statistic. This is descriptive. And then knowledge base system, biosignal, telehealth, and telemedicine. This is my area actually, telehealth and telemedicine. Uh, but it come from the healthcare information system. Yeah. That's why I told you just now how we want to go to telemedicine if we don't have a fundamental system. The healthcare information system is actually the fundamental. If you don't have the electronic health record, so how you want to do a data science, how you want to develop a big data, yeah, how you want to embed the AI in the healthcare information system because you don't have data. AI require data. AI require information uh, to teach the AI to get some result. Yeah, how you want to IoT the healthcare field? How you want to generate the notification for the patient uh, for the day for that day that the patient got high blood pressure if you don't have the data electronic health record. So that's why in this subject I focus on healthcare information system. But before that, I need to give you the understanding on the health informatics, what is healthcare information system, and so on. Yeah, this is very specific subject. Healthcare is very big, so I don't want to teach you about the electronic medical record framework and so on. Yeah, the policy, the procedure, but we only focus on the healthcare information system first. Yeah. So health informatics also cover the medical education. Okay, this is another innovation part of healthcare information system. So from the data we generate become electronic health record system or electronic medical record. So that data can be used for education. Yeah, the healthcare information system Like I show you just now, this one can be used for the medical student. So we expose to them how to use the application. I think one of the lacks of IT in Malaysia, I think medical student is not exposed to the IT. Maybe they should introduce one subject in their medical program, uh, the health informatics or software engineering, so that they can hire me to teach the software engineering subject to the medical student. Okay, who involved in the health informatics? Of course, the clinical personnel, non-clinical staff. Non-clinical staff, example, educator, administrator, research scientists, they need relevant data and information to perform their task. Healthcare administrator, CEO, COO, uh, DOO, LOO, I don't know DOO and LOO. This is short form of the personnel involved in the healthcare organization. Just a joke. Don't take a note of this one. Okay, health educator. Okay, some of the you see that there are two kind of hospital, three type of hospital in Malaysia. Uh, it's public hospital. We got a military hospital. We got uh, teaching hospital. So we got a lot of teaching hospital developed in our public university. For example, UKM hospital, UKM, what they call it, UKM in Bandar Tun Razak, Kuala Lumpur. Okay, we got PPUM, hospital, teaching hospital. We got Kubang Krian Hospital, HUSM in Kelantan. Okay, we got UPM Hospital. We got another coming hospital is Uniza, yeah, and also the USIM in Nilai. They also got the teaching hospital. Okay, we got IIUM, International Islamic University in Kuantan. Uh, okay, a lot of okay, we got UITM hospital in Sungai Buloh. Okay, we got 7 or 8 teaching hospital. So teaching hospital, the doctor is become a professional doctor and also the health educator. So they train the medical student to become a doctor. So this is very important. If uh, we don't have a substitute of a senior doctor, so we will got a shortage of the doctor. Information science, IT professional, policymakers, insurance companies, all these involved in health informatics. So insurance company, why they involved in the health informatics? Because they want the data. So they look at they need this data to check whether their uh, insurance member fit for their insurance policy. So this is a bad of insurance. They only offer to the healthy members, healthy person, because they don't want to rugi. They don't want to lose in your business, because insurance is like a gamble business. This is my word. Don't take this word. Because they are facing with they are managing the risk. Yeah. If if their members got bad health status, so maybe every day or every month they will lose the cash flow will be go out very fast, and they got bankrupt maybe. Okay, and policy makers, example, MOS government, yeah, this data It's very important for them to make it to plan for budget, national budget for healthcare, or private hospital. They have to the investor have to know the status of the hospital business, whether they want to reduce the scope of healthcare services or they want to increase the healthcare services is based on the data. Okay, so this is health informatics in the multidisciplinary field. So you can see the what they call it, the framework. Yeah. Okay, so this is a knowledge area of health informatics. Yeah, so academic, technology, statistics, nursing, dentist, uh, information technology, library science. So this is we a book, yeah, information about the healthcare or health. This is very important. Informatic. This is our area, information technology. So uh, we will socializing uh, with these people. And also we have technology in health informatics. So you see a personal computer, server, computer, handheld, monitoring device, and so forth. There are a lot of things that I'm not putting here. So this can be referred into Dimitros Zikos because this data is last 5 years or 3 years. Okay, so I don't have time to put my data here. Okay, and then this is another health informatics multidisciplinary field, the application architecture. Okay, so this is our focus, healthcare information system. So the ultimate goal is to generate the electronic health record or EMR, electronic medical record. So in the next chapter, I will explain to you what is electronic health record and what is the EMR. What is the difference between EMR and EHR? Okay, so this application will generate the electronic health record. This is ultimate goal, yeah, for planning, for treatment, for management, and etc. So health informatics requires standard. Yeah, if you want to develop a healthcare information system, so you must obey or you must include some standard, yeah, policies, interoperability, for example, using HS7 or other standard classification system, for example, terminology used, yeah, communication, what type of communications, and data quality. Data quality means the standard data. When you want to discharge the patient, so what are the standard data to be stored in the what are the standard data, minimum standard data to be stored in the database. Okay, otherwise that cannot be considered as a discharge summary, for example. Yeah. Okay, now come to the question, what is HIS? Yeah, you know about information in healthcare. I already explained you what is the informatic, what is the ICT, what is the health informatic. So what is the HIS, healthcare information system? So HIS about application system in the health sector. Very simple. So you use the information science, you use how to collect the data in healthcare. Okay, you combine with the technology, which is ICT, and the subject matter. You understand the process. You systematic. You systematize data into the systematic structure of the data, and then you design the UI, UX application, and become the system. So this is one of the health informatics application, and the differentiation between healthcare system and healthcare information system uh, is table in this diagram in this table. Okay? It's depicted in this table. So you can read by yourself what your healthcare system, and healthcare information system. So healthcare is focused on the medical care, refers to work done by healthcare professional. It involves home and community care. So healthcare system, where the healthcare organization uh, execute the process using a systematic way. So not to say that healthcare system, when we talk healthcare system, is a healthcare system that uses a computer. It's not yet to convert into the computer. Yeah, it's just a healthcare system, a process. It involves a systematic process from the beginning until the end of the patient discharged from the ward. So healthcare information system is about a system in the health sector. So healthcare system is a process in health sector. Okay. So healthcare information system refers to a system that contains information about individual health and activity of organization in health sector. Okay. And the use of information technology in healthcare. So that HRS. So healthcare system is involve economic and financial aspect, refers to an organization that established to meet the health need of target population, like MOH, yeah, Ministry of Health Malaysia, or Ministry of Health Palestine, yeah, and involve an organization or people or institution that engage in providing healthcare. So we take example, Ministry of Health, we got uh, what they call it, Center of Research. We got the Center of Cancer in Putrajaya. Yeah. We got IJN. IJN is semi-government, but is under a policy of MOH as well. Okay, this is term related in HRS, Health Information System or Health Informatics, telemedicine, telehealth, e-health, okay, mobile health. So you need to know when people ask you, are you familiar with a telemedicine system? Okay, telemedicine is a distant, health at distance using telecommunication and application or software to do uh, teleconferencing between patient and doctor at distance. Okay. Also same as telehealth. Telehealth is an expansion of telemedicine, involve administrative. E-health is about a broad term of healthcare. So that means one hospital they implement a digital what they call it, digital flow. Yeah, everything is flow by the electronic. The mobile health means uh, the application of healthcare information system is it's run in the mobile devices, yeah, and phone, tablet, and etc. Okay, in summary, health informatics is a field that concerns itself with a cognitive information processing and communication tool of medical practice, education, and research. Okay, uh, so health informatics is a umbrella, yeah, it's a big area which is healthcare information system is under the health informatic activities. So healthcare information system is a big, but it's under health informatic umbrella. Okay. That's why involve cognitive information processing, communication tool, medical practice. That means clinical part, education and research. So our portion is our focus in the on the communication tool of medical practice. We communication tool means we provide a application, yeah, for the medical practice uh, to what to collect, store, retrieve, and process the patient medical data. Okay, we are not entering the education part and also the research. So education in healthcare is very big. We need to develop the content. Yeah, to develop a content is not is very sensitive information. So we need the specialist, consultant, very expert people in certain area to write the contents. We cannot write the content or we just copy from other website and we copy and paste. Sometimes the information is not related to our country and our culture. When you ask the developed country regarding on the heart blood pressure range, so 140 is normal for them. Yeah, systolic and dystolic, right? Systolic 140, their dystolic is 90 or 95 is normal, but for our country consider normal high, is in the yellow line. Yeah. Okay, health informatics aim to improve the healthcare services by utilizing the ICT. When you talk about health informatics, is the marry of healthcare and also the ICT or computer science, information engineering, and so on. So without ICT, we cannot say health informatics. Yeah, we just say healthcare information only. Okay, healthcare information system is one of the interest area in health informatics. So this is what we will focus, healthcare information system. For degree level, so that's why I ask you to develop a healthcare information system, which give you the exposure, what is the component or what is the module involved in the hospital information system, for example. Yeah. So you know when let's say you involved in one project in healthcare, so you know what to do first. Okay. So you got already the idea. Oh, we start with the, let's say, four categories of healthcare information in healthcare. So we focus on the patient data, clinical data, administrative data. Yeah. uh, and then what are the module, MVP module, MVP product, minimum viable product for one clinic, for example. Let's say you develop one clinic system. Yeah. uh, and then you already know, okay, we need registration, for example, we need calling system, we need CIS, clinical information system, we need the pharmacy, and then we need the uh, billing, simple billing system. Okay. Okay, the question, try to answer by yourself. Brief, explain the own word why health informatics is not just computer application in hospital. Try to answer health informatics is an interdisciplinary field. Please refer the three disciplines with a brief explanation and refer to three reasons why health informatics is essential for quality healthcare services. And lastly, out of the many different roles involved in health informatics, which one do you find more intriguing and why? Yeah, intriguing means disrupt. It's more important. Yeah, which one is a priority? Okay. I think that's it for chapter one. So uh, you can write the question in the comment uh, comment box. Yeah. If you like this lecture, so press a like and share with your friend in other university. Okay, that's it. See you later. Thank you very much.